is Dates and Mates with your host, Damona Hoffman.
Hello, lovers. Welcome to Dates and Mates. This is the place where we are going to demystify modern love, make it simple for you. As always, we are broadcasting live from Sunset Gower Studios in Hollywood, and we're live streaming to Facebook. Hello, fans and friends. Today we have a really important show for you, and we're going to be talking about something that we kind of have tap danced around a little bit, but it's time for us to get we're going to get real today. Today we're going to talk about sexual health, and I have a very qualified expert. I have a nurse practitioner who is joining me in studio to answer your questions about sexual health, safe sex, so much more. His name is James Simmons, and he's going to be with us in a little bit, and we're going to go deep. No, wait, no pun intended. Okay, pun like a little bit intended. But we're going to go deep. So if you are squeamish about sex or you're listening with your mom, just know that you have been warned. All right. We have lots of headlines today as well, including a surprising statistic about Tinder users' sex lives. And a new dating trend to watch out for. We'll also discuss Ariana Grande's hot new beau. Hot new romance is brewing. And you all have so much brewing in your lives. We have your thought-provoking questions in Technically Dating, including, can your F-buddy neighbor become something more? And who needs to change? What needs to change if you and your partner have different sex drives? Such important questions. We'll get to that in a little bit. But first, let's do the headlines.
Dee's Dating Dish.
I also have, I forgot to mention, I have a special guest engineer in studio with me, producer Jarvis.
Hello.
Hello. I'm going to indoctrinate you into the dating dish and the headlines.
I'm ready.
Because something surprising, well, not surprising to me, but surprising to most people, hit the presses in Men's Health this week. Turns out Tinder users are having a lot less casual sex than you think. You probably thought, oh, hookup apps, people are just hooking up all the time, just getting it in.
Yeah, that's what it's for, right?
That's what people think. But here's the thing. There actually was a study, the Norwegian University of Science and Technology analyzed app users between 18 and 29. And we know that age group is having less sex overall, but they're really having less sex on dating apps. It turns out they're not using them for casual sex. They may have gone to the app with the intention of hooking up, but they're not moving offline. They're just chatting on their phones, and it's not actually happening. So the reality is your chances of getting shot down on Tinder are probably about the same as in a bar, so you could just kind of wait.
Yeah, it makes sense.
Yeah, weigh your options, and it's basically the same. Women are more discerning, like duh, but they're reading profiles more carefully than men who are kind of a little swipe right happy.
Men are probably just looking at the picture.
Of course they are.
Of course they are. And they just analyzed dating apps, which are really just picture based, and have had this reputation as being hookup apps. But I've said for the longest time, don't hate the playa. Hate the game.
Yeah. Don't hate the app, hate the game, because it's not the dating apps that are the problem. I think it's the whole way that we are communicating today, moving to the phone. The fact that we are so used to texting and sending messages out without actually having a phone call or an in-person meeting, that's why nobody's having sex anymore. If they're not having sex on Tinder, then I think the problem is bigger. And so I was happy to see in Men's Health that the quote was actually, I guess it's not entirely surprising given that public health experts, believe that there's too much hype about the supposed hookup culture created by dating apps. The hookup culture is a myth. It doesn't exist. It's not here. What we are in is the not communicating culture, and that's what I'm hoping that we can change. Another dating trend that I'm hoping that we can change is orbiting. There was an article on this in the Huffington Post this week. Do you know what orbiting is, Jarvis?
I have no idea.
Do you know what ghosting is? Let's start there.
I've heard of it, but I don't know what it is.
It's funny because doing this every day, I feel like these words are just top of mind for me all the time. And then I talk to other people and they're like, now what is that again? So ghosting is you're dating someone, it's hot and heavy, and then all of a sudden they just disappear. They're gone. Gone without a trace. They're a ghost, okay? Orbiting.
So is that men and women?
Oh yeah, anybody could.
So
be
women
a
are
ghost.
ghosting.
Please, yeah,
Really?
yeah. Women are, probably more guilty of ghosting.
Wow.
We got to get a study on ghosting. But okay, let me give you the scoop on orbiting, because I love to give you the dating terms. Orbiting is when you cut off all direct, meaningful contact, but you continue to engage with the person on social media. So you ghosted them, and yet you're still around. I think haunting might be another term for this. I'm always up on the dating term, but orbiting is the official term, and it can really be detrimental to someone's self-esteem, because especially if the relationship ended in a way where there wasn't closure, and you are still lurking around. You can see on Instagram,
right,
everybody who watches your videos, everybody who takes your polls on stories, who watches your stories, who's liking your posts. We know you're there. We know what you're doing. So why are you being creepy about it? Because everyone can see your actions online.
Right. So let me ask you this. This is what I'm wondering.
Yeah.
Is this like after just communication, or this is after like sex or
Good
like an
question,
emotional connection,
Jarvis.
and then someone goes?
Good question, Producer Jarvis. It can be after anything. It could be after a hot and heavy text session and then they disappear. It could be after a date. It could be after, in the article in HuffPost, they cited a situation where this woman had been on like 3 dates. She had met the guy's dad. She had hung out with his friends, and then he went on a work trip. And he was like, okay, we'll get together when I come back. And then, he was just gone. But he was lurking. He was lurking on social media. So he never really went away. And it can really damage someone's self-esteem if they feel like you're still checking them out, but you're not communicating with them. If the article recommends just disappear. If you're not into it, just what are you getting out of just creeping on somebody's Instagram?
This is so interesting. I'm trying to wrap my head around this. So let me ask you this. So are they doing this on purpose? Like, are they going into this knowing I'm going to ghost this person? Or is this something you're saying that happens after the 3rd day? Like, I'm not really interested. I'll just ghost him and don't tell him.
I will say I see it less after someone has made that kind of investment. That's sort of unusual for someone to go through multiple dates, meet the family, meet the friends, and then suddenly that person disappears. I think something happened on that person's work trip. I like to just hypothesize of what the situation might be. Something happened that caused him to change. But there are people who either have no intention of meeting up, and that's the whole catfish phenomenon.
Right.
Or there are people that like that initial contact, or were hoping for it to become physical and it didn't, had one intention that didn't turn out. And then they're like, well, I owed this person nothing, so it's just easier for me to disappear. But the orbiting is the weird part, because then they're sticking around on social media because they're still a little bit curious. I have to tell you about a celebrity couple that everybody is curious about. Ariana Grande has a new boyfriend. I was a little shocked about this one, I will admit, especially knowing her type. Pete Davidson from SNL is the guy. They are both 24. She guest hosted on SNL in 2016, so people are speculating that that's when they made a connection. But she was dating Mac Miller, and they broke up recently. And then he started having all kinds of trouble. He had a DUI. He crashed into a tree. It was a whole thing. And Pete Davidson, who used to date Larry David's daughter, Cassie, they just broke up a couple of days ago. And then all of a sudden, all of the business with Ariana Grande and Pete Miller came out. It's interesting because Pete also has had substance abuse problems. He's been in and out of rehab. And he was saying that Cassie was really instrumental in him getting sober. And yet, here he is with Ariana Grande just a couple days after they split. And I really wonder what this means for Ariana, because she clearly has a pattern here.
Right.
Of dating these guys that they're conflicted. They have a part of themselves that they are looking to fill with drugs and alcohol.
Maybe she thinks she can heal them.
Maybe she thinks she can
like
heal
a lot
them.
of women do, right?
I know, but I'm kind of upset that she would get out of this relationship, which she says was toxic, and I think the alcohol was a big part of that, from what I've read. And yet she gets into a relationship with somebody else who's battling the same thing. And it's like, girl, you got to look at your dating patterns here. This is something that is clearly feeding something in her if she's doing this again and
Do
again.
we know if she's had any issues in the past?
Oh, come on, she's Disney.
I'm just saying.
We don't know.
Right.
We don't know.
Right.
Maybe she's into that. I don't know. But what I do like is that she's going for the funny guy. Because I'm always telling my clients, it's not about being the most buff. It's not about having the cutest face. If you can make a girl laugh, that is the way into her heart. We're going to take a quick break. When I come back, my in-studio guest, James Simmons, is going to set you straight on sex, on sexual health, and all this juicy stuff that we haven't gone in too deep on, but we're going to do it today. So stick around. I'm your host, Damona Hoffman, and we'll be back after this message. Whether you're single or in a relationship, one thing that you need to feel is sexy. And I know just as well as anyone that when you're carrying around a few extra pounds, sexy is the last thing that you feel, right? When you feel good about your body, others will feel good about being with you. So let me guess a couple of your excuses for working out and getting in shape. Let's see. Number 1, you hate sweaty, stinky gyms. Number 2, you don't have any cute workout clothes to wear. Number 3, you don't have time to work out. Now, I'm going to blow all of those excuses out of the water when I tell you that you can get fit on your schedule, wearing whatever the heck you want in the privacy of your own home. You, my friend, need to try BeachBody On Demand. And now fans of Dates and Mates can get all the BeachBody programs for $99 a year, 30 days risk-free. You can stream all of BeachBody's fitness programs and get the nutritional guides on 21-Day Fix, PiYo, Insanity, T25, P90X, P90X3, and more. I've been actually doing P90X3 myself, and I love the 30-minute format. It's so quick, and I know you've got 30 minutes. So you owe it to yourself to try the entire BeachBody On Demand system completely risk-free. Just click the link in the show notes or go to datesandmates.com and click the BeachBody banner to get started. Welcome back to Dates and Mates. Y'all, it's time for the talk, for the sex talk. Let me introduce my special guest to you. James Simmons is a board-certified nurse practitioner. He currently practices as an internal medicine hospitalist in Los Angeles. He has more than 8 years of critical care experience, which basically means he's seen a lot of crazy stuff, y'all. And you can watch his video series, The Weekly Dose, on AskTheNP.org. Please give big smooches to my guest, James Simmons. All right.
There's the kisses. Thank you so much. So happy to be
So
here.
glad that you're here.
Thank you.
We have been orbiting each other for a while.
We have been orbiting. I did not know that phrase at all.
Okay.
I have
See,
learned
I like
something.
to
Right.
I like to edutain people.
Edutate. That is exactly what we do. So it's orbiting, not stalking, because I feel like just the like colloquial, like layman's terms, it's like I'm just stalking them, but not really interacting.
It's like low-key stalking. If you showed up and you were at their house, peering in their windows, that's when the restraining order comes in. But you can just low-key casual stalk on Instagram, no big deal.
Exactly. Yeah.
I haven't been stalking you, but we have been orbiting because you have so much great information on The Weekly Dose and on Ask the NP about sexual health. And all the time, people are sending in questions here about sex, and I'm not a sexpert. I'm a dating and relationship expert, and sex is one part of that. But I can't know everything, y'all. So I need to bring in the big guns.
But you're so smart. You do know everything. You know at least to bring in a big gun.
I am a know-it-all, but I do not know everything that you do. And one thing that is coming up a lot as we were talking about hookup culture in the first, the hookup culture that doesn't exist, but the reality is people are having more sex. And I'm even seeing statistics in the over 50 crowd as online dating has become more popular. STIs, STDs, you can correct me on how I should describe them. They are on the rise. And I feel like the conversation has shifted. Like when I was a kid, it was all over MTV, like wear a condom, safe sex. And I feel like we're not talking about it anymore. So let's talk about it now. What are the biggest risks? Because, there's some STIs you can take a pill for. There's some that are a bigger issue. But like what really should people be looking out for?
Looking out for is really everything. And I think you're seeing such a big change from kind of like how we grew up in the MTV culture and all these fear tactics. Because one of the things we're learning, and there was a lot in the question you just asked, because we have so many points to get to, but that's good. I think one of the things we're finding out about STDs and STIs is that fear tactics don't necessarily work. They work. There's actually been a lot of research done on this, that you can, certain populations and certain types of things you can fear people into taking action with. But otherwise, fear tactics have a threshold. They only work so much, and then after that, they stop working. So that's sort of why you've seen the messaging change in the last, even around HIV, for instance, even in the last 5 or 6 years, the messaging around HIV prevention has dramatically changed away from fear tactics. But then some people will point to the fact that that's why there's HIV rates skyrocketing in certain populations.
So what is the proper messaging? What should we be telling people so they can stay sexually healthy?
Right. Very true. Well, and I want to say before we even talk anymore, I think one of the things that makes it hard to talk about is what you said earlier. Are they STIs? Are they STDs?
Let's break it down.
Yeah.
Is STD, sexually transmitted disease, STI, sexually transmitted infections.
Right.
What's the difference?
There really isn't much of a difference. It's sort of a semantic kind of thing. I mean, if you really want to get medical and clinical, we can talk about that offline, or people can email me or hit me up on Instagram about that. But really, I want to take all that away because I want to make it really easy for people to talk about. So as far as I'm concerned, you can call it whatever you want as long as we're talking about it. So we'll call them STDs, STIs. I think the biggest thing that people have to realize is that prevention absolutely is key. So and you can really relate this to almost any clinical or medical issue. So it's a heck of a lot easier to not get fat than to fix it when you're 700 pounds. Does that make sense? It's a heck of a lot easier to prevent a heart attack than to live through one, or then have to go through the rehab and change your lifestyles afterwards. So much cancers. There are at least 8 cancers that we know that are preventable. So if you just get ahead of these things and prevent it and have that as your mindset going in, and then also I think there's kind of an undercurrent going on in the hashtag Me Too conversation and this empowerment of women, and particularly cisgendered women, but even transgender women who are really starting to feel like I actually, in Hollywood or not, I actually have ownership of my space and my body, and I get to talk about this in the way that I want to talk about it. And I'm gonna own my body. You're not gonna own my body. And I think that that's starting to translate into conversations I'll say in the bedroom, but sex happens everywhere. It's translating into conversations in the bedroom where women are saying time out. Like particularly younger women, I think aren't thinking, well, I gotta have sex with this person and I'm just gonna let them do it however they want. And maybe that's without a condom because I want them to like me. Like, I don't think women aren't rocking that anymore. Certainly it still happens. But a lot more women are feeling much more empowered, particularly in the last couple of years, about being like, no, if you want some of this, you got to wrap it up. Like, plain and simple.
And can we also talk about women needing to take responsibility for their own sexual health too? Because a lot of times I'll say to women, well, you have condoms in your purse, right? And they're like, no, he's supposed to have the condoms. That's his job. And I'm like, it's going to become your job when you catch something.
Correct.
Right?
And I love how you say that because, and again, I want to be explicitly clear and careful that I think sometimes in STD, STI, HIV, even pregnancy world, sort of the things that happen after you have sex, there's a lot of victim blaming that goes on. And so I want to be careful that sometimes that same message can get lumped in. Well, if you didn't want to get raped, you shouldn't have worn that dress.
Oh no, that's not what I'm saying. But
correct.
Glad that you're
some people,
clarifying.
but just so that we clarify that. But then absolutely, as a part of that empowerment, you should absolutely have condoms and lube in your purse, and you should be willing to just talk about that in the bar before it happens.
I'm scared of the lube though. Because like, what if that burst in your
lube
purse?
is great.
No, but in your purse?
Yeah, you can get ones with really good clips, and you know what? I keep mine in a little Ziploc bag when we travel, so that if the lube spills out, it's still in the Ziploc bag, and then it's not getting out all over my stuff. Because even from a health standpoint, lube helps reduce the risk of transmission of all sexually transmitted diseases.
Hold on, wait. I gave you orbiting. Now you're giving me knowledge.
I'm breaking down the lube.
Yeah?
Because
How?
So microscopic transmission of sexually of any of those, so viruses, bacteria, happens on the microscopic level, and if you can prevent that tearing of the skin, vaginally, anally, even orally, if you can prevent the tearing of that skin through lubrication, you're less likely to actually be the reciprocal, like receive the disease from someone else. So it's disclaimer.
Wow.
We're getting nasty.
Yeah. If you learn nothing else from this show today, that is
Isn't that
Dates and Mates gold.
So like bottom line, and this is what I do on Ask the NP, and this is why I love what I do, is I'm real. Like we got to be real at talking about this stuff, or people aren't going to feel empowered and get healthy. So if you are, doesn't matter, cis, trans, straight, gay, black, white, purple, whatever, if you're having anal sex, there is usually a higher aptitude that you're going to have microscopic tearing of your skin. And so your bloodstream is then 100% exposed to whatever bodily fluids get on your butt while you're having anal sex. But if you use a lot of lube, or you've used a toy beforehand to prepare yourself, or you've practiced at this, that skin is tougher and that skin doesn't tear as much. So then you don't have an open bloodstream route for an infection to get into. It literally is that simple with the lube.
Okay. Now, we're all lube converts here now. And let's talk about condoms for a minute.
Okay.
Because I was reading an article and it was like, oh, there's so many STDs, STIs you can get still wearing a condom. And I was like, oh my God, what do we do now? James Simmons, I'm asking the NP, what do we do?
It's you still wear a condom, trust me. And I have to be really careful about. I think the conversation about protecting ourselves, I never want to feel. The conversation is sort of changing in terms of we're not being judgy of people who choose not to wear condoms anymore.
Oh no, I am.
That
You don't have to be because
You
you're
will
a
be?
medical professional.
well,
I am. I'm judgy.
and I would rather, in all circumstances, wear a condom unless you know this person very well, you have been tested thoroughly, and you know that neither of you are sleeping around on the other one, right? If you are in a committed actually monogamous relationship, you get the testing done, fine. Have all the condomless sex you want to have.
And if you also are on birth control, if you don't want to have
Correct.
a
Right.
pregnancy and you are taking it consistently on the schedule you're supposed to. Had to add that a little
Yeah,
bit.
please. But for everybody else out there, because that's not a lot of people, everybody else out there, condoms really will prevent most STDs and STIs. The problem is no one uses condoms when they're having oral sex. Like, let's just be real. In fact, only 20% of millennials consider oral sex. So you can give a blowjob to somebody on Hollywood Boulevard in the car and that you didn't have sex with them.
You're a virgin.
You're still a virgin, right? But you can get herpes giving
In your
someone
mouth.
oral sex, right?
Yeah.
You can get some other STDs, even if that person, let's say the guy you were giving a blowjob to, didn't know, because chlamydia and gonorrhea, which are the second and third most common STDs, often more than 50% of people, there's no signs and symptoms.
Oh, goodness.
I know, it's scary. So he might not have known. He might have hooked up with somebody a few weeks ago. He might have known he had it. And then you give him a blowjob on Hollywood Boulevard, but you're like, it's cool because blowjobs are safer. And they are. They are much safer without a condom. But then all of a sudden, you have signs and symptoms now.
Wait. Okay, so what? I have to get clinical. What can
Please
get transmitted through oral sex? Which STIs are you susceptible to getting orally?
So both types of herpes. So there's the herpes 1, which is like the mouth sore that like
Is there a good kind?
No, there's no.
Herpes the good kind and herpes the bad kind.
That sounds like an advertisement. Herpes, the good kind. Mentos, the fresh maker. Herpes, the good kind. No, I will say one is better than the other. HSV1, so that's herpes simplex virus 1, is like the oral herpes that most people have at some point in their life. It manifests itself as a cold sore. That can obviously be transmitted orally. HSV2, which is like genital herpes, can be exposed. You can be exposed to it orally, particularly if that person has sores and those sores have broken open, because then you're directly exposed to the virus. It's much harder if someone does not have sores and or those sores are not broken open to transmit it, but it's still possible. HPV, the big controversial one with the vaccines and kids and all that stuff, that can also be, some studies are showing, be transmitted orally. In fact, it can be transmitted orally, and the men are 8 times more likely to have the version that ends up causing some type of oral pharyngeal cancer. So tongue cancer, throat cancer.
See, we talked about Catherine Zeta-Jones and, oh my God, I'm blanking on his name.
I just lost it. Michael.
Her
husband?
Yes. And there was a whole story.
I went to Michael Keaton, but it's not Michael
I know.
Keaton.
It was like Michael Sheen. No, that's not his name. Okay.
We'll come around.
So he had throat cancer, and there was a story that he got it from HPV from oral sex, and I was like, no, there's no way. And I said, well, I don't have an expert in the house, but now I have an expert in the house. That can actually happen.
It's possible. It's much more probable that he smoked at some point in his life, even if for just a couple of years, and that increased his risk. Oral pharyngeal cancers are generally rare. They're generally caused by smoking, but there is a strain of this HPV, and there's actually more than 40 strains of HPV, so I want to be very clear with everyone that there's lots of strains of this, but one of the strains of HPV puts men in particular at 8 times higher risk of these oral pharyngeal cancers that can be transmitted through sex or oral sex. So it is theoretically possible that he got this, but they're both older. Most of the time, the HPV virus clears itself from the body. We highly recommend that you vaccinate your kids. You can start as early as age 11. And it goes
God
up through
help
age
us.
26, right?
But hey, talk to him. Got to do what you got to do.
Well, and that's the controversy. Doing what you got to do is, okay, I'm going to give you this shot. And your 11-year-old is like, why are you giving me this shot now? And you're like, well, because at some point, hopefully way down the line, you're going to have sex. And this will prevent the most common, this is number 1, actually. HPV is the most common sexually transmitted disease.
Wow. And then that also can cause infertility in women. There's a lot of side effects to that.
Cervical cancer, big time.
Cervical cancer.
Some research is saying maybe even like uterine cancers and tubal ovarian cancers, but definitely cervical cancer.
You just don't want it. You don't want it. Michael Douglas, I got it.
Michael Douglas, yay! We did it. Thank
Yay,
you.
Michael Douglas.
Sorry,
we're clearing your good name.
You're only like a legend. Your dad was a legend.
I know.
Like,
sorry,
Kirk and
There's
Michael.
a lot fuzzy in my brain.
No, that's all right.
Okay, so I also discovered that it's May. I knew it was May, but I discovered.
I just now discovered.
Wait, what month is it? What day is it? No, it's May, and I just discovered that May is International Masturbation Month because we needed a month for that. So there was a survey that was released with some interesting results. Can you talk us through this survey about masturbation on Toller Road?
I love these results, by the way. I'm sorry that I don't mean to be completely ignoring anyone out there when the camera is on me. I'm so sorry. I'm going to acknowledge you because we're having a group conversation here. So I thought this survey was really interesting and wonderful. I do have to say, as with all survey research, you always have to be careful of where the survey research is coming from, who did the research, maybe what their motivation was behind it, who funded it. So this particular research happened to be the largest survey research in the world ever of people's masturbation habits. So that's awesome. Really great, amazing, juicy data. It also was done by a sex toy company, so which is not bad. Like, that's great. But they threw in a bunch of questions about, like, how much better is your masturbation life with sex toys? Oh, it's a lot better. Great. Use ours. I'm sure that's what happened from it. But what's great is that the epidemiological world, so those of us who, like, get off on statistics and, like, health, this gave some really great information. So 95% of men in the United States masturbate. Not a surprise.
I don't think it's 95, if I can be honest.
You know-
Because this is also based on self-reporting, right?
Correct. Yes.
So I think it's maybe more like 99.9% if we're really
right.
being honest.
I'm like,
right?
where did this other 4.5% go? Like, why?
They're like, not me. Never.
And they're
Okay, but let's assume it's 95.
It's 95%. I think it was 83% of women in the United States self-report masturbation. But what the variances on this were really fantastic was the amount of time. So on average, and they went as young as 18, and I think the oldest person in the study was 85. 18 to 85, the average amount that men masturbate is 5 times a week.
Oh, really?
Yeah. For some reason, I
Wow.
thought it'd be higher too.
I wonder if that number is different for people that are in relationships where they're sexually active multiple times per week.
This, at least the research that I was able to, or the data that I was able to get from this research, they didn't pull that out.
Yeah.
So who knows?
Because people aren't thinking of.
Unintended. Hey there.
I like you.
Sorry.
Because they're thinking about sex toys and they're thinking, oh well, couples aren't often thinking about using sex toys. Although I advocate for it often.
100%. And there was a question in there about their they were asking if partners thought that their significant other made a better lover because they used sex toys. So they definitely had some data in there from people who were in relationships. They just didn't, I guess, publish the data in terms of like, is this 4.8 technically? 4.8 times a week average when you're single, or when you're in a relationship and it's really 3. But when you're single, it's 8. So we end up meeting in the middle.
It's fine. I get you.
There were big variances in age. So as you can imagine, younger people and millennials masturbated almost 7 times. Men masturbated almost 7 times a week. Women were 4 times a week.
Really,
in
people
the
are
younger age.
stressed, but it has positive effects, right?
100%. That you just said stress being the number one. Men reported that relieving stress was the number one reason that they masturbated.
That's it.
I
What
think it's fine. It's
What
lovely.
are other reasons?
Well, maybe because it feels good.
Well, I think it's also good to know what you like. So when you are with a partner, you can communicate that. Because I'm always shocked at the number of people who just have no idea because they haven't even experimented with themselves. And a lot of times, if you're not in a committed relationship with someone that you feel comfortable with, like you're not really experimenting with one night stands because you're still kind of figuring out how the parts go together when you're with someone new.
And you're with someone new and you're really uncomfortable. You know, I thought it was really interesting. We're going to just veer off just a tiny bit. I was reading a Hollywood Reporter article yesterday that had Maggie Gyllenhaal in it and Elizabeth Moss and all of these wonderful women, Angela Bassett, who they were talking about this new female empowerment in Hollywood. And one of the things that Maggie Gyllenhaal was talking about in her show, The Deuce, and she's a prostitute in this show,
Sure.
A sex worker, and she has lots of sex, and she sort of parlays that into like a directing porn career. And she wanted to show realistic portrayals of female orgasm. And so she's like, I'm going to film this scene and I'm going to do it in the nude and I'm going to fake it for the camera. I'm not actually going to masturbate, but I'm going to show you what it's like. Because she was like, I'm going to take away this porn image of what female ejaculation, I guess, if you will, that happens too, but female orgasm looks like. And I just thought that was really so interesting that even I, of course, went to health, right? And even the psychology of all of this. Like if you're on a one-night stand, and is that even about you? I know when I've been on one-night stands, I'm like, this individual is incredibly good looking. This is going to happen, and I'm going to orgasm, and it's going to be amazing. Like men, that's what we do. We go for it. But is there a
Women,
different?
we have to get comfortable.
Yeah.
Like there are just sometimes even with my husband, I'm just like, oh, I'm just not comfortable. Like I just can't right now. You know, where it's not even about like not feeling attracted to him or not being interested in sex, but sometimes if you're just straight up not comfortable, like
it just ain't happening. But I don't know, Jarvis, I don't know if you
happening.
agree with me or not, being the two fellas. Like, listen, I don't know if I've ever been too uncomfortable to have an orgasm. Like, to be totally honest, I might prefer to be in a particular position. Like, I kind of like to lay down and be cozy, whatever. But,
Yeah.
But if I'm standing on a balcony in a hotel in Cancun, like, it's still going to happen.
it wouldn't happen
there's
for
no
me
such
either.
thing for a man.
Right,
I don't
as
think
being
so.
too uncomfortable?
No.
I would not
no.
be comfortable on a balcony because, see, I'd be like, people are looking at me. What if I fall from the balcony? Like, I have all these
Totally.
crazy anxiety thoughts, and I'm like, oh, now I'm all anxious. I can't climax. I'm
But
too anxious.
That anxiety, though, I think comes back to bringing it back to sexual health. It comes back to that anxiety and that those walls that particularly heterosexual identified cis men and women have to really start to meet at, because if you're uncomfortable even to talk about your orgasm or how you're going to be comfortable in this particular sexual situation, and especially if it's a newer person, you're really going to be uncomfortable talking about, like, hey, I have herpes.
Right.
I haven't had a flare in 3 years. I take my medications every day. I have no sores whatsoever, but you got to wrap it up. I promise this is still going to be hot and heavy and super fun, whatever, but like, I know we were at the
I
bar,
have herpes.
but I got herpes, right?
Nobody wants to have that conversation.
Totally.
So then they just pass it on. Then we just have more herpes.
And then there's just ding, 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 ding. So
We don't need
much
that.
of sexual health, we don't need that. So much of sexual health is that communication. Like, get your knowledge together. Like, get your smarts on. Just read a little bit. We can all Google it. You can come to me. You can listen to your show. You can do whatever. There's so much sexual health resources out there. Get your information together. Throw some condoms in your purse, and then you have to feel empowered. Then you have to feel like I can have this conversation. Then you can have, you have to be like, look, I don't want chlamydia. Like, I want babies down the road. So, like, can you wrap this up, please? Thanks. Mm-hmm. And I guarantee you so many more men are going to respond to that.
Well, they want to get it in. So you do what you have to do.
Exactly.
I mean, I could go on if we have more topics.
We do. I know.
But I
We
want to
could go
get
on.
the people at home some help on the questions that they've submitted this week.
100%.
So we're going to move on to technically dating.
Technically dating.
And this segment is brought to you in partnership with the Techspert app, where you can get crowdsourced advice for your drama. You can download it for free in the App Store. Okay. James Simmons of AskTheNP.org. Tell me what you say to this. This comes to us from a female. She's 18. She says, I recently hooked up with my neighbor who is single. I was very lonely and I've been single for a long time. I feel kind of awkward now. He contacted me a few times, but I'm not really putting effort into chasing him. And he's the same way with me. We're both lazy and shy. I usually let people initiate with me. I wonder if we could be boyfriend and girlfriend, but I don't know. I was just so lonely and I thought he was hot. I worry that maybe he doesn't want a relationship other than sex, and I don't know. I might too. She's like all over the
place.
map, right?
Can I-
so
can
does
I
she want a
first say-
relationship? Does she not?
Right.
Yeah.
Do you want a relationship? That's
Yeah.
actually the bottom line question. You have to answer for yourself.
Right.
Honestly. And can I just say, Boo, I love you for writing in. This is great. I'm glad that you're thinking through this, and we are here to help you. But girl, you're only 18. You can't have, I've been single for so long. Girl, you're only 18. You
I
can't have
know.
been
I felt
single
that
for
way
that
too.
long.
And then I met my husband when I was like 24. And I'm like, I felt like I was single for decades. And I'm like, I was single for 52
You're like,
minutes.
Wait a minute, I'm only 24. But listen, this is where your brain goes at 18, and that's fine.
Yes.
I think that you have to really look back, and I would say this to someone who is 18. I would say this to someone who is 85. I had to check myself and say this to myself before I got into my relationship. You really have to know what you want, and what your big no-nos are. What's the right word I'm looking for? Damona, I know you talk about this, but what are your deal breakers? Like
Deal breakers.
What are the deal breakers, and what are the things that you're going to be okay living with? Because my husband checks off all of my. He does not have any of my deal breakers, but he drives me crazy sometimes, right? Like that's like every good husband should, right? I want to wring his neck, but at the end of the day, I look at him and I'm like, well, but these 4 things are cool.
Core values.
And core values, and I love you, even though I want to strangle you right now. And I just don't know if you know yourself enough and what you're looking for and what those deal breakers are at 18.
Sure.
So, girl, if you need to get some now and then, grab a condom, start some prep, please. We haven't even talked about prep, but get on prep, wear a condom, and have as much fun with your neighbor as you want. But just wait on the relationship.
Can you tell everybody what PrEP is?
Yes, I can. Pre-exposure prophylaxis. I'm so excited about it. It is the 2-drug combo in one pill that is 99% effective at preventing HIV if taken every day.
Wow. And so you recommend doing that in addition to wearing a condom?
Absolutely, because it only protects against HIV. So it doesn't protect against herpes or
Babies.
HPV or babies or chlamydia or gonorrhea.
I need baby protection.
Or syphilis.
Girl, you need baby protection. You're 18. Yeah. Yes, agree with you 100%. And I also just want to say, by the way, it's totally fine that you had sex with your neighbor. And it can just be that. And that's fine as long as you guys can pass each other in the hallway, have your groceries and smile. Mm-hmm. And it doesn't have to be weird. That's fine. You're in an exploratory phase, and why are we always in such a hurry to label things? You don't have to. Right?
Amen, sister. Amen.
I'm progressive in the dating coach arena. Okay, this comes to us from a female. She's 23, James. Mm-hmm. She says, so lately, I really haven't been having sex with my boyfriend, and he's a really sexually active person, but I can go days or months without sex. And he just told me that he talked to a girl last night, and they were going to meet up this morning, but he didn't go. But he told her that he was. And I honestly don't know how to feel. Like, it's my fault. Is it my fault for not having sex with him? Help. Caps, exclamation point. Help. James Simmons, AskTheNP.org. What do you tell this lady who... Can we break it down into parts?
Please.
A lot of these questions come in. They don't realize how layered they are when they ask the question.
Absolutely.
So there's part one is she's not interested in sex really. That she said days or months.
Big difference, by the way.
By the way, yeah. I'm like, okay, 3 days different than 3 months.
3 months.
But it sounds like maybe her sex drive is on the low side. Mm-hmm. And then there's this other question of if he has to get his needs met elsewhere, is that a failing in her or the relationship?
Ooh, and you use the big F word, the big
Failing?
fail word.
Well,
yeah.
But
go
big.
And I think that's okay. go big or go home, right? Mm-hmm. There's a lot of this. You know what I immediately, of course, I go to the health aspect of this. Like, there are many more, at least documented instances of women who have lower sex drive, but I don't really believe it because a lot of this research and a lot of the movies and stories and radios and just popular media over the years has been driven by like middle-aged white men who are sort of don't understand women, I think, and then we're just going to portray you in this movie of like, this is a woman who's not really sexually active that, doesn't want sex. Just because a woman doesn't want sexual pleasure in the same way that a man does doesn't mean that she doesn't want it as much.
She just doesn't want sex with you.
Yeah.
No.
Ding, ding, ding. Love it.
No, but I think there's a lot of guys that aren't thinking about female pleasure when they're having sex, and they're like, I don't know why she didn't want to have sex with me.
Why does she want to have sex with me? But I go medically to, is something maybe a little bit medically wrong? Are your hormones a little bit off? Is this a psychological issue?
Are you depressed?
Are you depressed? Or to your point, Damona, what you just said, is the sex with him really bad? Like, even when I want to strangle my husband, I'm like, yeah, but we're going to get it in tomorrow. You know what I mean? Because I'm still, 5 years later, I'm still really attracted to him, and we have phenomenal sex. It keeps getting better. I'm super lucky. But, like, if you can go 3 months without kicking it with your boo, and that's your boo, there's a way deeper. So if you can even clear off the medical stuff, there's a lot more going on there. I think it would be really rare from a medical standpoint to have someone who just is completely not into sex for 3 months who had been into sex previously.
Right.
There are asexual people out there. I actually believe that exists. So if she has not identified herself as one of those people, then something else is going on, and he's going to go get it somewhere else if you don't give it up.
But he has to communicate with her, not after the fact. He needed to have that conversation before.
Amen.
And say, these are my sexual needs. We got to work on this. Or how would it feel for you if I got that need met elsewhere, and then listen to what she says. Okay, we have more questions, so I want to keep on rolling.
Yeah.
This comes to us from a young female. I was like, I have to do this question with James Simmons because you'll see why. She says, she's a female, 20. She says, what does it mean if your vagina burns after sex without a condom?
Dun, dun, dun. One of my favorite professors who taught me said if it burns when you pee, it's a UTI or an STD.
Ooh.
Period. End of discussion, right? Super easy. You got something brewing down there, and it's probably an infection. Now, that's when you pee. If your vagina just in and of itself burns after intercourse without a condom, could be any number of things. Pelvic inflammatory disease, trichomonas, those two things can tend to burn. It could also just be from the friction of sex.
Sometimes it gets real rough up there,
really
you know?
Rough. And if he's
and it was no
like,
condom, so there's no lube that's built in. So if she didn't add lube and she was not necessarily lubricated, there may have been some,
correct.
Friction.
It could be just as simple as the friction. And there's good friction and there's bad friction.
So how many days before she needs to seek medical help?
24 hours. If it's not better in 24 hours, you got to go in, have somebody. It's a quick swab. You can do it out of urgent care. No judgment. We see this all the time. I always want to tell people this. If you feel like something's going on, go in and get it checked out. We are not judging you. We're really not, because we've probably all been there ourselves anyway. Just go in. We're more upset if you're like, well, my vagina's been burning for 6 months and now I'm coming in. That's when we're going to judge you. But if it's 48 hours and you're like, damn, my vagina still itches, like get your butt in there, go to the urgent care. We'll give you some antibiotics. Off you go.
Off you go. Okay, one last question before I have to let you go. This comes to us from a female who's from Australia. It doesn't say how old she is, but she said, is it bad I haven't orgasmed once since I had sex with my boyfriend? We've done it 7 times. Newish relationship. Is it bad? No orgasm.
No, I don't think it's bad from a medical standpoint. I think you guys just haven't figured this out yet, because most men probably don't know how to make most women orgasm. Talk to them about it.
Yeah, and you might need to also introduce some of the toys, or because not every woman really can orgasm through. I'm like, what are the
penetration?
I'm like,
is that what you're trying to say?
Penetration. I was trying to find like the clinical terms, and I was like, I'm intimidated because if I say the wrong thing, I feel like,
no.
You're...
That's my whole shtick. Is we get rid of the clinical terms, because I think everyone gets sort of nervous and tongue tied. No, a lot of women don't orgasm or don't even get a ton of pleasure really from penetration without some sort of like clitoral stimulation. So if that's not how it's working, just be like, hey, dude, we've had sex 7 times now and I haven't gotten mine. You get yours every time, but I haven't gotten mine. We're going to try it this way. That's what I mean with that empowerment. Or just pull out the toy.
And they like that too. They like it when you take control. Okay, I said that was the last question, but I have one last quick question, because I can't ask this question of anyone else.
Sure.
Female 19 from Canada says, is it weird that I use a vibrating toothbrush to masturbate? I swear this was a question that came in this week.
Absolutely
I did not
not.
make it up.
Absolutely.
A vibrating toothbrush? It's got those bristles and whatnot?
So listen, again, you said some people like it a little rough. I would recommend that you cover the bristles, though, because there's, that the dirtiest part of our whole body is our mouth. It's actually dirtier than our asshole.
Oh, no, don't use the one that you're using for your teeth,
Right.
please.
So
use a separate one.
God, yeah, I hope you're using a separate one. But listen, boo, there's cheap vibrators. Like, they're like $20. Go get a real vibrator. You'll probably be happier with it.
Okay, thank you so much for all the knowledge you've shared.
Absolutely.
I know this is what you do every day.
I love it, though.
At askthenp.org.
Yep.
And yeah, thank you for taking away the stigma and for making all this information accessible to the Dates and Mates audience.
Thank you. And thank you, Dates and Mates audience, and you for having me. It's my pleasure.
Shucks, you'll be back. I know you'll be back.
Yay.
And hopefully you all will be back as well. We have another exciting show coming next week. In the meantime, you can send me your questions at Damona Hoffman on all the socials, or you can even leave me a voicemail, 424-246-6255. Again, the number's 424-246-6255. And if you want to spice things up a little bit, why not check out that Adam and Eve adamandeve.com offer that I mentioned earlier. You can go to adamandeve.com and don't forget to use the offer code GIFT21 so you can get all your free swag and get it on. In the meantime, next week I'll be back with Sherry Gaba. She is from the hit TV series Celebrity Rehab. Until then, I wish you happy dating.